think we should start by now. Okay, so welcome everyone. Some of you may know me, others may not. So my name is Wafa. I work in the UK. I've been tutoring for Part 3 since 2018. My group is called MRCOG Part 3 Circle. And every now and then I do free sessions, but to be honest, and I'm really sorry for that, I've been really busy with work and everything. So it's been a really long time since I did free classes or posted videos on YouTube or Facebook, but hopefully I'll get back on track. Okay. So I thought about this as an interesting topic to talk about because a lot of people approach me, either they're preparing for the exam for the first time or they did take the exam either once or twice. Even some approach me while they have their last attempt, which is the 4th attempt left, and they're not sure about where they went wrong. And I do think that especially for the Part 3 MRCOG, it's hugely different from the Part 2 MRCOG, because for Part 2, you just study the knowledge and you just memorize stuff, do a couple of questions, and then you go in. But for the Part 3, even if you do go through all the recalls and they come exactly the same, you may still not pass the exam, okay? Because it's about how you prepare for the exam, your understanding about the exam, rather than you knowing what the answer is. Because let's say, for example, you got a case of so the case that I'll be using today would be endometrial hyperplasia. Okay, so let's say you got a case of endometrial hyperplasia as a recall and it came exactly the same in the exam. That patient who came the first time in the exam, okay, her attitude, her questions, her body language, the sequence of her questioning. So let's say they told you the patient asked 5 questions. The order in which you ask the questions, maybe they will be different because they don't just memorize things, they just go along with the flow. They tell them you have these number of questions, ask them along the way if the candidate doesn't like discuss or talk about it. So when you come in the exam, you say, okay, I've practiced endometrial hyperplasia before, let's say with atypia and in a young woman, and now it's coming again. When you go in with that mindset, you would not be listening to the patient. You may not, you be ignoring her questions. She will be asking you, you would be deliberately ignoring them, but you have a certain agenda in your head and you like memorize stuff and said, okay, this is what I'm going to mention, okay? And I do understand that because with the stress of the exam, you may not be in a position to like think along the line or improvise along the line, okay? But if you prepare the way that I'm going to explain to you today, it will make your life much more easier, okay? So our topic for the day is called How to Stay Ahead of the Curve and Be at the Top of Your Game. I just want to say that the recording would be available in a few, I can't promise when, but in a few days up to a week on our social media. Throughout, if you have any questions, write them down. We do have episodes of questions and answers. I'll be answering them. If you want me to unmute you, I'll unmute you and we can discuss. Okay, and don't forget to follow us on Facebook and YouTube because I have really good videos on YouTube. The last one was a year ago, but then we have lots of views. We have around 586 or around 600, basically 600,000 views for the videos, and they did help candidates a lot. So please take advantage of that, go through the videos. Also, there's few videos and posts on our Facebook group, and we also have a Telegram group as well. Okay, and the Telegram group was really nicely organized. I used to pin all of the responses to the candidates that I put there, either voice notes, I like answering through voice notes, or typing down, and I used to pin them at the top. I had around over 100 responses to various questions and topics that I pinned, but one day just accidentally I unpinned all of them. And since the group goes back to all the way to 2018, I didn't find time to pin them back again, but I promise I will pin them so it'll be easy for you to access the various answers that I gave to topics, okay? All right, so I'm just going to turn off the video because it's getting in the way of my screen and I can't really see the screen clearly, and then I'll put it on back again. All right. Okay, so what I'm going to talk about is a 4-step process that I want all of you to implement, whether you're preparing for the first time or this is your second, third, or fourth attempt. Okay, no matter how far you are in your preparation, it's never too late to apply this. So the 4-step process is learning, reflecting, implementing, and sharing, and it has to be done in a stepwise manner in the exact same order. Let's start with learning. Okay, so for learning, that means your study material. And when it comes to study material, it's important to bear in mind and understand how this study material is going to help you in dealing with Part 3 exam scenarios. You have 2 main resources for your knowledge. That's the Green Top Guidelines, NICE Guidelines, and TOG articles. You also have the scientific impact papers on the RCOG website as well. These are the basis of your knowledge. It gives you the right and most up-to-date information that you will give to the patient, and also you will give to the examiner when you have structured discussion tasks. And number one under the domain of applied clinical knowledge in the exam is that your knowledge has to be up to date. And where are you going to take that from? It's from your guidelines and TOG articles. The second will be, so these are the top 2 for your knowledge. You then have patient information leaflets, strategy videos, and some YouTube videos as well. Patient information leaflets, they are extremely important, especially for those who are overseas, those who are working in the country. You don't really have to go through leaflets because you already talk to patients in layman terminology, okay? Because in the exam, talking to the patient in a way that they understand is the number 1 key for effective communication. If you're using lots of medical jargon, you will not pass the communication with the patient, okay? And you may not even pass the exam as well. So how do patient information leaflets help you? So for those who don't know what patient information leaflets are, they're leaflets given to patients regarding their condition, okay? If they're having a certain condition like miscarriage, ectopic pregnancy, polycystic ovarian syndrome, endometriosis. There's also leaflets for treatments, like medical treatment of miscarriage. There's leaflets for that. Methotrexate for ectopic pregnancy, there's a leaflet. Surgical procedures like hysteroscopy, hysterectomy, cesarean section. All of these have leaflets, and they're usually given to patients at the end of the consultation. Patients go through them, read them, they understand fully about their condition and the treatment that they're going to receive. So it's written in a language that patients do understand. And for you to be able to discuss that with the patient, okay, the knowledge that you took from the guideline and the TOG article, you have to convey it to the patient, right, in patient simulated tasks. For you to do that, that specific language, you get it from the patient information leaflet. There's some limitations for patient information leaflets because, you know, for those who don't work in the country, usually there's RCOG guidelines, okay? Not all topics have guidelines for them. And plus, some hospitals have their own guidelines, okay? And in turn, they have their own leaflets. So for example, you can find the treatment for IUGR or SGA in the guideline. It's different from the local hospital's guideline, okay? And in turn, they put leaflets according to their guidelines. So there are leaflets from specific NHS trusts or hospitals. Now, in the exams, when you Google, I usually tell my students, go and just Google any leaflet that you want. Just write the name of the topic, like endometrial hyperplasia, information leaflet. If you come across one in the RCOG website, that's perfect. If not, right next to it, NHS. And then you'll find leaflets for endometrial hyperplasia from different NHS hospitals. But then the problem with that is that the information in that leaflet may not be the same as what the guideline recommends because it's following that local hospital's guideline. That's not a problem. You will find discrepancy, but the important information is that from that leaflet from that hospital that has a different management plan, you just extract the explanation and that's it. Don't go ahead with what they recommend as management. Just extract the language that is used. For example, the language that is used to explain endometrial hyperplasia, the language that is used to explain to the patient what investigations you want to do, or to explain hysteroscopy, okay, or explain hysterectomy, or the different hormonal treatments. Because at the end, the management plan collectively, it's the same options, but the order may differ. So that's what you need to pay attention to. But if you have a leaflet directly from the RCOG website, you just follow exactly what they say in terms of the steps of the management. Okay, so the number one important resource or study material for you would be patient information leaflets. You have to spend more time on them than the guidelines, because the guidelines, you've already gone through them for your Part 2 MRCOG. Strategy has very beautiful, nice videos. You can subscribe to it. I think they give you, I don't know the amount now. I think it's 30 something or 40 pounds. I think subscription is for around 6 months, and you have access to the videos. There are some videos from Strategy floating around social media, but the problem, I've looked at them before, the problem with them is that they don't have the examiner's comments, because in the middle, the examiner, they pause the scenario, the examiner comments and says, this candidate did this, this, and this right. I like what they did. I don't think they should have said this, okay, or I think they should have avoided saying this. So they give comments along the way. The ones that are floating in social media, they don't have those comments. And also Strategy, they renew their videos every now and then. So it is worthwhile to subscribe for them, okay, because it's done by the Royal College, and it shows you their way of thinking, their way of marking, and what they would expect from you as a candidate in the exam. YouTube as well has lots of videos. For me, when I was preparing for my exam back in 2017, whenever I'm bored, I just go to YouTube, write anything down. Like, for example, I had an issue in dealing with premature ovarian failure. I didn't really understand the impact of that on patients, so I just wrote it down, and I watched videos of patients talking about how they felt. That's how I understood that, okay, that is really breaking bad news. This is the way they felt. This is what I'm supposed to do when I'm discussing it with them and breaking the news. Okay, you can also, for example, in other breaking bad news or dealing with an upset or an angry relative or a patient, it doesn't have to be in obstetrics and gynecology. It doesn't have to be from the UK. It can be American, Australian, anything, but as long as the language is English, of course. And just watch them. It can be on surgery, pediatrics, general medicine. Just watch their body language, their attitude, and how they communicate, okay, with the patients in front of them. So that's how you can learn from YouTube videos. There's also these are the least important, so these are the first 4 important ones for you. You have online sessions, lots of free online sessions going around. Everyone is doing them, so whenever you have the opportunity, log in, listen, learn. You have courses, lots and plenty of online and on-site live courses that you can attend. There's lots of templates floating around social media. Just make sure when you read the template, please don't blindly follow it. There's no model answer for any case scenario in the exam, because like I said, you're not talking on your own, you're interacting with the patient. That patient may ask you questions differently, and you may not know how to answer them if you just fix yourself to a template. I usually call it general heading. So people ask me, can you give me a model answer to this? I tell them that, sorry, there's no model answer. I can just give you headings, what to cover, okay? If a patient with ectopic pregnancy comes to you, but I can't really tell you exactly how we're going to respond, okay? And there's also online groups, Facebook and Telegram. So for online groups here, I do highly recommend it because it maximizes your exposure. And when you join a learning community, that would help you to be relevant with the exam. And also groups can open discussions and cases you may not even have thought of before and came across before. And it's also a really great place to get support from your colleagues, because all of them are on the same boat. And having said that, although studying in groups online gives you insight on how cases are approached by your colleagues and those that pass the exam before at the same time, it's a double-edged sword, because you won't be always be able to identify a good or perfect answer. Okay, and the answer may be given to you wrongly. I've gone through recalls before where people have put their answers. They put their answers according to what they understood the patient wanted. Follow the headings in terms of what the scenario was about, but please always go and double check with your guideline. Okay, whenever you have a ready-made answer for any from your colleagues you find on social media, even from my groups, from my YouTube channel, don't blindly follow it. Always go and double check with the guideline or the patient information leaflets. Or learning, that's your learning stage. Okay, that's your study material that you need to have. And when you're learning, you must ensure that the quality of input, that means the quality of your study material, is really high, and you must pay high attention when you are studying, either a guideline, oh sorry, I forgot books as well. There's plenty of books that you can read, or you're attending a session, or you're watching a video on strategy or on YouTube. You really have to focus, because if you have your phone nearby, and while you're studying and trying to understand, your phone bleeps, you go and you check it, and it kills that momentum and the quality of the input that you're putting in, okay, for your exam. Because the quality of the time that you put while studying it determines the quality of you retaining the information and recalling it. So did you ever think why children are fast learners? They just, quickly learn things and memorize them, because they're curious, they have attention, and they are focused. They don't have problems like us adults to think about at all. So if you try to focus and concentrate, okay, you would, and stay away from distraction, just pay 100% attention during that time when you're doing that learning phase, which is your input phase. Okay, so we've agreed now where your learning or your study material would be from. It would be from these resources. Now let's go to the next step. After you finish learning, what are you going to do? So after you finish reading a certain guideline, okay, or a certain TOG article, followed directly with an information leaflet, and perhaps watching a video of a case scenario, or reading a book that has a case scenario of that topic you read, think, okay, I've read it, I've looked at examples, how can I use this for the exam? And the answer for that is take out your notebook. You have to have a notebook. Make your own summary or template in terms of headings. I've put here an example just to show you how to do that, because a lot of people get confused and they write for one case 2 or 3 pages. 1 page, even half of a page is enough. So this is an example. Okay, if I was to write a template, or generally for my students, when I have a template in front of me, I mark them according to this. So this is a case of endometrial hyperplasia with ATP in a young lady who doesn't have children. After you finish reading the guideline and the information leaflet, you're going to bring your notebook down. You're going to sit and say, okay, if I have a case like this, this is what I'm going to do. First of all, I'm going to start introduce myself, confirm the identity of the patient, set my agenda. And then I'll start with history. Your history just be with points. Okay, I didn't write, ideally you should write down the questions you're going to ask. Okay, but the most important things, like here in this case, would be the patient's symptoms, any risk factors for her endometrial hyperplasia, and does she have any contraindications for the treatment that I'm going to offer her? You're being safe. After your history, you send okay, my next step would be to explain the histopathology result, or you can turn them around. You can explain the result first and then take the history, and it's not really breaking bad news here, because breaking bad news would be cancer. Okay, you don't, just to avoid the confusion, you don't break bad news. So you explain the histopathology result, and then you say, okay, I'm going to talk about my management plan. If she's completed her family, my option would be a total laparoscopic hysterectomy or abdominal hysterectomy. Okay, if she didn't complete her family, she desires fertility, then I have hormonal options. Now, when I come to the hormonal options, I'm going to discuss with her the risks of these, because what is recommended, like what the guideline mentions, is a hysterectomy. So since she's not going to go for a hysterectomy, even if she goes on hormonal treatment, these are the risks: cancer, metastasis, death. Okay, therefore, before going on with the management, she needs an MRI scan, CA125, and explain to her why. MDT, fast track within 2 weeks. Then the first line option would be Marina, talk about the side effects and the follow-up. Ask her if she refuses or asks for an alternative. You have the oral progesterone. It's less effective, more side effects, and you talk about the follow-up. And then after that, if she has any risk factors like a high BMI, she's smoking, advising her to reduce those risk factors, and then tell her that if she, along the line or from the history, you know that she does want to get pregnant, we advise her against pregnancy for the time being. When you do have at least one negative sample, refer her to a fertility center to help her get pregnant quickly. And then the recommended end management plan would be a hysterectomy after completing her family. At the end, further appointment with the consultant, information leaflet, right to the GP. This should be your template, and everything I have written down here. Let me put on the pen. Everything that I've written down here from here to here, literally, it is from the guideline. That's how your summary should be when you read a guideline. The rest are general communication aspects. You wouldn't find these here like in the guideline. These are basic ABCs when you're preparing for the part 3. So the top 3, and then the further appointment, the information leaflet, and wrap. These are fixed. Okay, it can change a little bit according to the module and according to the case, but in the middle, this is what you're going to get from the guideline, this part. So this is how your summary should be for any case that you do, and please do it right away after you finish reading the guideline, your information leaflet. At the same sitting, don't say, okay, I'm going to do it tomorrow. No, when it's still there in your brain, okay, it's fresh, just do it right away. And I would recommend is that write down on the side or on the bottom your domains. And communication with patients, it's something that you don't have to write down, because it's something that you will practice when you're talking. And it's the same for every patient you talk to. But what you need to focus on is colleagues. Okay, so after you put your template like this, you go through it and say, okay, if I have communication with colleagues in this case, what would it be? What would they be looking for? So it's be MDT and GP. Okay, if they have safety, and there would be safety in the case, what would they be looking for? So risk factors for the endometrial hyperplasia. Am I asking for any contraindications for hormonal treatment before offering it to the patient? Did I mention the risk of not having a hysterectomy? Okay, and you have to mention the risk in numbers. That's mentioned in the guideline. And the last one would be talking about fast track, which is the 2-week pathway for any patient who has cancer or the suspicion of cancer or high risk of cancer, and especially for these endometrial hyperplasia with atypia. Why and they want to preserve the uterus is that you're not in a position, because you know the risks that come with it, even if she has hormonal treatment. You know the risks, right? So it has to be, you can't, as a registrar, ST5, in the exam or in the clinic, especially in the exam, say, okay, you want hormonal treatment, here it is. It has to go through MDT. So this is just an example of how your notes should be. So we agree again, 1 page for each case scenario, okay? And even if you're joining any online course and you're supposed to prepare a case, or on the free Telegram groups, you're preparing a case, you write it the same way on your notes, and then hold your recorder. I used to use my phone, or if you have a small portable recorder, use it, and then look at your points and start talking. Like, I'll give you an example. Let's say I've written this down and I say, okay, I'm gonna practice it on my own now, and this is going to take me to the next step. So I'm going to leave this now for the time being to the next step, okay, to give you the example. So I agreed now, you've gone through the guideline, information leaflet, watched a video or read a case related to that topic on a book, or found a case on the recalls, or someone solved a case before and you read it. You then reflect, which is you writing down your own notes and thinking about, okay, this is how I'm going to approach it. It doesn't have to be perfect. At least you have tried. Some people, what they do is that they stop here, okay? Why? Because when they do the above 2 steps that I mentioned, you can feel great, have an illusion, okay, say I'm competent, I've learned it, and then you go, you just end it here. That endometrial hyperplasia with endometrial hyperplasia topic or guideline, you end it here and you go and open a new topic like polycystic ovarian syndrome or endometriosis. If you stop at this point, you're basically doing what is called shallow learning, okay? Shallow learning, and you're not retaining any information at all. If you do this, you cut it here and you go to the next topic. So what you're supposed to do is, after you learn, reflect, and summarize, you go and implement. How are you going to implement this? I know a lot of you must have heard this. A lot of people say, for the part 3, when you ask for their advice, they just tell you practice, practice, practice. Just talk and practice as much as you can, and they're not mistaken. That is right, either alone or with a study partner, and I would recommend with a study partner. Okay, so again, reading and having your own summary means nothing if you do not implement what you have learned. And by implementing, I mean practicing the case scenario. Okay, spend twice the time on implementing and practicing, okay, twice the time you spent on learning. So let's say, I usually tell my students, because you've read the guidelines before, it's not fresh to you, even if it was 4 or 5 years ago, it doesn't matter. You've read it before, it's somewhere there lingering in your brain. Give yourself 30 minutes maximum for a guideline. Endometrial hyperplasia, read it quickly in 30 minutes maximum, please. If you're really slow, take breaks in between, an hour. Okay, let's say I'll give you an hour. After you read the guideline, take around half an hour again to read the leaflet. Okay, so let's say half an hour a guideline, half an hour to read a leaflet, and then that would be an hour, right? And then you want to summarize. Your summary would be, let's say, another half an hour, so an hour and a half you spent on learning and reflecting. Now, the time you're going to spend on practicing that case should be double the time you spent on learning and summarizing it. So if you spent an hour and a half preparing until you reach that point when you put your summary and template, you should spend at least 3 hours practicing that case and repeating it. Okay, so let's say you practiced it today alone, practice it with your study partner on the same day or the next day. You can, of course, when you practice it on your own, it's not going to exceed 10 minutes, because in the exam you have 10 minutes. Repeat it again. Please, I have to calculate that, okay? I know it's a lot to do, but you will thank me at the end. This is how you're going to return the information in your head, okay? And it's going to be there, and you will never, ever, ever forget it. So practice, like I said, spend twice the amount of time practicing. It doesn't matter if it's, some people tell me, well, if I'm practicing it, I don't know, am I doing it right or wrong when I'm talking to myself, or even when my study partner is in the same boat as me, we're new to this. We don't know if we're doing things right. For example, my study partner wouldn't know if they were giving me I wouldn't know if they're giving me good feedback or not, because they're just learning like me. It doesn't matter. Okay, the end point is for you just to practice and get your tongue going and talking and timing yourself in 10 minutes, because someone once said a lousy action is better than no action at all. I have some people in my course, they do join as active, but then I realized the first few sessions they say, no, I don't want to present now. I do understand, because they feel, I was there in their shoes before. You would feel that, okay, I'm gonna be very stupid, silly, I'm not gonna say the important points, I don't have no idea how to communicate. It doesn't matter. Do mistakes during courses, much more better than doing the mistake in the exam. Okay, unfortunately it's on my old phone and it's not working now. If I send you guys the recording of myself when I started practicing for the first time, comparing it to how I counsel patients now, you're not going to believe that's me. There's always a start point. It doesn't matter. Okay, you don't have to be good from the beginning. Okay, so now we agree that you really have to implement. By implementing, I mean practicing. Record yourself alone and listen to it, or with your study partner. When it's with your study partner, I'll come later on talk about how to find a study partner and what qualities you would need in a study partner. But even with a study partner, record yourself and listen to it whenever you're free. Anything that you practice or say verbally, please just try to record it. And with your study partner, practice video, not audio, because the exam is not audio. It's either face-to-face or online where they can see your face. So at least you would be doing that for a few good couple of months, and you'll get used to it, because you will take away that stress you're going to feel when you sit in front of the examiner or look at the patient and talk to them face-to-face for the first time. Now, after you implement, you then want to share. And then the best way to learn something is to teach it, because you're helping your own brain to pay more attention. Discuss it, okay? Discuss it in open platforms on the internet. Discuss it with one of your colleagues at work. Tell them this is what you need to do in terms of endometrial hyperplasia, 1, 2, 3, 4. So at least the points, the knowledge would be there in your head. Like, for example, the topics that I have in my course that I teach, I know them inside out by heart, okay? Because I've been teaching it for a long time. I can just quickly, swiftly do the case scenario. But for some topics that I didn't teach, I may struggle a little bit or pause in between when I'm talking about management plans. I'll just be thinking along the line. But because I've been teaching it, it's just there, 1, 2, 3, 4, from the beginning until the end. So I would recommend you do the same. Some people will say that's a waste of time. It's better for me to spend time watching strategy videos or reading information leaflets. No, like I said, the time for that input should be very minimal. The time for your output, which is practicing either alone with your study partner and discussing it with people, or teaching it to your study partner or your colleagues, that should be the bulk or the maximum amount of time you're going to spend in preparing, particularly for the MRCOG Part 3. Okay, so this is just a summary again for this 4 actions step. You need to do them stepwise for each topic, please, before going on to the next. You need to learn, and these are your resources that we mentioned: information leaflets, TOG articles, NICE guidelines, RCOG guidelines, TOG articles, NICE guidelines. You have information leaflets, you have strategy videos, YouTube videos, online cases in books, and you have your courses that you attend. After you learn, you want to reflect by doing your summary. Even if you attend, let's say you attended today with me a course session, okay? I covered 4 cases, let's say, and I told you what the answer is. Don't only rely on that. After you finish, go quickly, 30 minutes your guideline, 30 minutes your information leaflets, 30 minutes look at the answer that I gave, okay, instead of going into video. So that would be your video or example of the case. And then after that, go and practice it. Even if you presented it during the session, you need to practice it either alone or with your study partner. That's how you should do it, okay? So you reflect, that would be your summary. Sorry, you implement, that would be your practice, either alone or with your study partner, and then you share it, go and discuss and teach it with someone. After you finish that, then go ahead to the next topic. So if we summarize these steps, you have input, like I mentioned earlier. Input would be your learning phase, okay? And you can see here in terms of time frames, you can see the time here spent on the input. It's much more lesser than the time spent on the output, okay? So you have your input, which is your learning phase, reading from your resources, and then you have your output. And I divide it clearly here just to show you demonstration that how much time you should spend doing these 3 steps. So after you finish or before you start studying, think about, say, okay, how much time did I spend on learning, then reflecting, implementing, and churning? In other words, specific for the MRCOG Part 3, how much time did I spend on reading from the study material versus the time I spent on practicing it and discussing it and summarizing, practicing and discussing it. If, let's say, you spend, like I said, again, I repeat it, 1 hour or 1 hour and a half on the learning phase, which is reading from your resources, spend the double that time on practicing, okay? Because especially that discussion part and teaching, when you learn something, if you don't use it, you lose it. And all of you know that, and it does makes much more sense. That's the reason why I'm repeating myself and saying that you need to focus more on practicing and discussing the cases rather than reading and summarizing the cases. And before we go on to the next part of the session, does anyone have any question? Oh, sorry, I forgot. I was supposed to give you an example. Let me go back. Sorry, I just remembered now. Let me go back. So we were talking here about this, right? In terms of be reflecting, having written your summary, when you go on to doing this step, implementing or practicing it, how are you going to do that? And like I mentioned earlier, you're going to have this in front of you. Don't try to memorize it. You're just practicing. You're not in an exam. Even if you are doing it during a course session, have that in front of you. It's not cheating. Okay, so let's say you have this in front of you, and then you start and follow. So I'm just going to put the highlighter while I'm talking. So I'm going to say, I hope I'm going to finish this in 10 minutes, but let's see. Okay, so I'm going to say, hello, my name is Wafa. I'm one of the doctors in clinic today. Can I just confirm your name and age, please? What would you like me to call you? Please call me Wafa. Samantha, how are you doing this morning? Okay, so do you know why you came in to the clinic today? Well, yes, I wanted to discuss my result report. Okay, yeah, that's fine. So what I'm going to do is just ask you a few questions. We'll then go and just go through your result and then discuss what we can do to help you in terms of further management options. Okay, she will say yes, and then I'm going to start taking the history. So can you tell me, why did you have the sample taken on the first place? Okay, so that's an open-ended question. She's going to talk and mention. I'm going to ask, so that's basically me asking her about her symptoms, and I'll go and dig into her period, look for any risk factors along the line when it comes to the social history like smoking and so on, medical history, because diabetes, can be a risk factor. And then I'm going to look and see if she has, she's on any medications, like hormonal medications that can interact with what I'm going to offer her. Did she have any surgery before? Because she may say she wants a hysterectomy and she's completed her family. I'm going to go to the obstetric history, see if she has gotten pregnant before. Does she want to get pregnant again and have children or not? Okay, so after I finish from the history, thank you for sharing this information with me. So let's come along to your report. So I've just confirmed that this belongs to you with your name and NHS number. So basically, like just to recap what you told me, the sample was taken because you were complaining of heavy irregular periods, and the scan showed that the lining of your womb was a little bit thick, so that's why they took a sample to see the nature of those that, or let's say the nature of the cells in the lining of the womb. It came out as something we call endometrial hyperplasia with atypia. So basically, you have overgrowth of the cells there. They can either be normal or abnormal, or cancer. In your case, they're abnormal. I want to assure you they're not cancer, but with this condition, if it's left untreated along the line after years and years, it may develop into cancer. Okay, and then you're gonna, so here I explained the histopathology report. Any questions, or does that make sense to you? Making sure she understood, and then I'm gonna go to the management plan. So I'm gonna tell her, okay, so I'm just gonna take you through what we recommend in terms of options for you. Feel free to ask me any questions along the line if you would like to. So basically, I understand that you do want to have children, right? Just to confirm it. So usually with a condition like this, if a lady has completed her family, she doesn't want more children, and if she's postmenopausal as well, we recommend a hysterectomy operation to remove the womb. But for women who do want to have children, we do have other alternative options in terms of hormones that we give. But you have to know that even when we give you that treatment, there is still a chance that despite giving you that treatment, that I'm going to explain to you how it's going to work, the cells may still progress into cancer, and that can spread and it may lead to death. I don't want to scare you, but it's something that you need to know about as a risk. In terms of the options, the hormonal treatment, what we would recommend as a first line is the Mirena coil. Have you heard about it? A lot of women know what a Mirena coil is. So if she tells you no, tell her it's a T-shaped device covered by a hormone called progesterone. It's inserted vaginally. No, it's very simple procedure, done in clinic, takes a few minutes, and we place it inside the womb. That hormone thins out the lining of the womb and controls the growth of those cells. It does have side effects such as 1, 2, 3, 4, and usually we would follow you up by taking a sample from the lining of your womb every X amount of time. What do you think about this? So I'm trying to see if she's refusing or asking for an alternative, because the guideline clearly recommends that this is the first line. They didn't say mention a Mirena and equally give her the option of oral progesterone. No, they clearly mentioned if for any reason she does not want that Mirena, you then offer her this. So you have to be clear when you're reading the guideline, see what they mention in terms of the order. Okay, is it either or is it if they refuse this, then offer them this? Okay, or is it a stepwise manner management? So if she says, well, no, I don't want it, I don't really feel comfortable having a coil inside, tell her, okay, alternatively, we do have the same hormone that's found in the Mirena, but it's taken as pills. It's less effective in treating your condition than the Mirena coil, okay? And since the hormone would be in your bloodstream, it would have more hormonal side effects, such as 1, 2, 3, 4, and the follow-up would be like this, and you mention it, okay? Then ask her, does that make sense? Any questions? So tell her these are your options. Now, before going on and treating you with any of these options that you want, or starting any of these two, we would need to do further investigations just to exclude the possibility of any cancer. That would be doing an MRI scan to look at your womb, and just a blood test to check for a protein that is related to ovarian cancer. These are just precautions that we do before starting you on that hormonal treatment. And then your case would be discussed in a group of doctors or group of professionals who would go through your case and kind of recommend which treatment option to go through. And of course, they would put your preferences in mind as well, or into consideration. Okay, so after you finish, if she has any risk factors like diabetes, smoking, or high BMI, tell her that having a high BMI can be, it's a risk factor for having endometrial hyperplasia. So we would recommend that you try to lose a little bit of weight. If you're struggling through your GP, you can have access to a dietitian and exercise groups. If she's smoking, tell her smoking is a risk factor for hyperplasia. So along with the treatment, we would recommend that you try to cut on smoking. We do have NHS stop smoking services that can support you. Okay. And then tell her after you, so since you want to have, if she wants to have children, then you talk about fertility, or she would ask you, okay, can I get pregnant while I'm on that treatment? Tell her no, unfortunately no, because these are contraceptives as well. But we usually follow you up with the samples that I mentioned. If we have one sample that is clear and it's normal, then we can refer you to a fertility center to help you get pregnant as quickly as possible. And then once you've completed your family, we would strongly recommend having a hysterectomy done. See what she thinks and then tell her okay, summarize, tell her okay. So I'm going to order the investigations for you today. You can book your blood test and you receive a letter regarding your MRI scan to come in and do it. And when we have your result, your case will be discussed in the MDT, and then we'll bring you in to see which treatment option we'll start you on, and then we can take it on from there. Meanwhile, I'll give you a leaflet. I'll write back to the GP. So you don't need to give a further appointment with the consultant here, because you are sending her for investigations. Unless she tells you, no, I don't want any of these treatments, then you have to involve the consultant to come and, you know, negotiate with her and discuss with her. Okay, so you can see this is how the headings are going to help you when you're practicing a case scenario. Okay, I have 1 minute and 50 seconds. Although I skipped history, but I was explaining in between.